How do you accurately interpret TB test results? Imagine a tiny skin bump telling a story about your exposure to tuberculosis. Interpreting these results correctly is crucial for diagnosis and treatment. The most common screening tests are the tuberculin skin test and blood tests called interferon gamma releases assays. Today, we focus on the skin test, which involves a simple injection under the skin, usually on the forearm. After about 48 to 72 hours, a healthcare professional examines the site for a firm, raised area called induration. It's important to measure only this hard bump in millimeters, not redness or swelling. The exact size matters because it helps determine if the test is positive or negative, based on guidelines from health authorities. Timing is key. The test must be read within the 48 to 72 hour window. Reading too early or too late can lead to inaccurate results. When measuring, only the induration is considered. For example, if the bump measures 5 millimeters or more, it might be positive, but whether it's considered positive depends on the person's risk factors. For those with the highest risk, such as people with HIV or recent TB contact, a bump of 5 millimeters or more is enough to be positive. For people with moderate risk, like recent immigrants from countries with high TB rates or residents of high-risk settings, a 10-millimeter bump counts as positive. In individuals with no known risk factors, a bump of 15 millimeters or more is needed to consider the test positive. Healthcare providers assess each person's risk before testing, which guides how they interpret the results. A positive skin test suggests TB infection but does not confirm active disease. Further tests like chest X-rays and sputum analysis are necessary to determine if the infection is active. Accurate documentation of the measurement, the reading time, and who performed the test is essential for proper follow-up and public health tracking. It's also important to consider factors like prior BCG vaccination, which can cause a false positive, especially years after vaccination. If there's doubt about the result, or if the person did not return within the testing window, the test may need to be repeated. Blood tests called interferon gamma releases assays are useful alternatives, especially for those vaccinated with BCG or who cannot return for a skin test reading. These blood tests are not affected by prior vaccination and do not requiring a second visit, but they are more costly and need laboratory processing. Remember, a positive TB test indicates infection, but not necessarily active disease. It's a sign that further evaluation is needed. Patients with latent TB infection may be offered treatment to prevent future active disease. Those with symptoms or abnormal chest images requiring prompt investigation for active TB. Always consult healthcare professionals for personalized interpretation, as individual circumstances and local guidelines can influence results. Accurate reading, proper follow-up, and professional advice are the keys to managing TB effectively and safely.